This conference will now be recorded.
Mr. Jackson, we're just checking to make sure you can hear us, sir.
You in? After we motion him in. Got him, Alan? Okay. Well, we'll check him after we motion him in, all right? Okay, the Madison County Board of Supervisors meeting will come to order. Welcome, everybody. Please join us in the Pledge of Allegiance, followed by a moment of silence.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. The first order of business is to consider a motion to authorize Chairman Jackson to join virtually. So in accordance with the Code of Virginia, I ask Supervisor Huffman to read the motion, please.
Okay. I, Charlotte Hoffman, hereby move to permit Clay Jackson to attend the September 26, 2023 meeting of the Madison County Board of Supervisors remotely pursuant to Virginia Code Section 2.2-3708.2 and Section 2.4.f of the bylaws of Madison County. Clay Jackson is unable to attend the meeting currently scheduled for September 26, 2023 in person because of a personal business commitment outside the Commonwealth of Virginia. This is the first meeting Clay Jackson has been unable to attend in person this calendar year.
Second.
Very well, we have a motion and a second to allow Mr. Chairman Jackson to join virtually. Is there any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, nay. Motion carries. So let the record show that we have a quorum with all members present. We have an agenda before us. Any changes you have, Mr. Weekly?
No changes, Mr. Yao.
Any changes or additions that any of the board members have?
No, sir.
If not, could I get a motion to approve?
So moved.
Second.
Very well, we have a motion to approve the agenda as presented and a second. Any further discussion? All in favor say aye.
Aye.
Opposed, nay. So, Mr. Jackson, can you hear us?
I can. Thank you all for having me.
Very well,
I
okay.
want to capture his vote, Mr.
Yeah.
Yao.
Yeah, I vote aye too.
Okay. All right, the next item on the agenda is public comment. The floor is now open for any general public comment. We have two public hearings later on that are halfway down the agenda, so you can wait till then if you have any comments on those items, but now this is just general public comment. So I'll open the floor for general public comment. If you would, come to the podium and state your name and what part of the county you live in. What we got online, Alan, anything? But they're not inclined to comment on anything, huh? Mm-hmm.
If anyone online would like to make a public comment, please do so now or put it in the chat and I will relay it to the Board of Supervisors. Mr. Schneider, do you have your hand up? All right, please go ahead, sir.
Good evening, everyone. My name is Brett Schneider. I live in Charlottesville. I'm not a resident of Madison County. But I want to share a few comments in regards to the presentation that you all have on community paramedicine that's scheduled for this evening. I'm a paramedic with 20 years of experience, and I currently work as a program manager at UVA. UVA Health, and one of the programs I manage is a grant-funded workforce development program. One area that we are concentrating our efforts in is community paramedicine. Madison County Department of EMS is one of our partners. We've been working with Chief Hillstrom and Tiffany Ranenbarger over the last year on a variety of initiatives, and I wanted to lend my voice and the voice of UVA Health in support of their efforts. Community paramedicine is just now taking root in our area. UVA, along with a handful of other agencies in Central Virginia, have begun formally providing these types of services with very promising results. Traditionally, EMS is reactive. So if someone calls 911, we respond and take the patient to the hospital. But so many patients need more than what traditional EMS can offer them. Community paramedicine takes this traditional reactive model and asks EMS providers to become proactive. The objectives now become establishing relationships and assessing the needs of the patient in a comprehensive manner and connecting them with the resources that are most appropriate for them. Community paramedics that are already working in our region have done everything from helping patients refill medications, providing referrals to social services, and even building a wheelchair ramp for patients in need. So I wanted to urge the board and everyone in attendance this evening to please give careful consideration to the presentation from Chief Hillstrom and Ms. Ranenbarger. And we believe that community paramedicine has the potential to make a significant impact in the health and well-being of the citizens of your county. Thank you.
Thank you, Mr. Snyder. Anyone else in the audience? We will have another public comment period at the end of our meeting, so. Very well, with no further comments, the first public comment period is closed. Okay, next agenda item is the consent agenda. We have a proposed supplemental appropriation number 3. Mr. Weekly, you want to briefly tell the constituents what that is about?
I can, and I may actually call on Chief Hillstrom as well if any further details. This is a grant that came to us via UVA. I think actually Mr. Snyder, who you just heard from, is aware of this. So anytime grant funding, whether it's for programming or specific equipment, those monies land at the treasurer and then have to be supplemented into the appropriate department in the line item. So that's what you have before you. If there's any specifics of the grant, how it will be used, I would defer to Chief Hillstrom, who's in the audience tonight, if you have any of those questions.
It's pretty straightforward. Anybody got any questions about this? Very well. I entertain a motion on the consent agenda.
Mr. Chairman, I move that we approve the consent agenda as presented.
Second.
Very well. We have a motion and second to approve the consent agenda, which includes the supplemental appropriation there, as stated. Any further discussion? Very well. All in favor say aye. Aye. Opposed, nay. Motion carries. Next on the agenda, we've got a special appearance from Frances Lacey of the Madison Learning Center. Welcome, Ms. Lacey.
Thank you. Good evening, and thank you for the opportunity to address the Board of Supervisors. And I would like to acknowledge, and turn on the mic, I'd like to acknowledge and thank some of my staff, some of our families that have come tonight, and some of our community supporters who are also here as I talk to you. And ahead of time, if I keep saying we, it doesn't mean just me. It's easier than saying Madison Learning Center 15 million times, so please understand that. I'm Frances
Can you
Lacey.
turn your mic up, Cordy?
Pardon?
Can you turn your mic up?
Mr. Barry, he's working on that now.
Okay.
Mr. Jackson, thank you for making us aware.
All right, try again?
Yes, ma'am.
Okay. I'm Frances Lacey. I'm the board chair of the nonprofit Madison Learning Center Incorporated. We're also known as Madison Learning Center, or MLC. The building that houses MLC has been on South Main Street since 2016. It was built then by Culpeper Memorial Hospital as a child care center. Madison Learning Center has been in the building since August of 2014. First under the umbrella of the nonprofit organization here in Madison called MESA. And then in December of 2019, Madison Learning Center Incorporated became its own, gained its own nonprofit status and its own board. When MLC became its own nonprofit, the building was deeded to Madison Learning Center by Culpeper Wellness Foundation, who at that time owned the building. This was a very generous gift, to say the least, but with it comes all the responsibilities for the maintenance, repairs, utilities, insurance, taxes on the building, and taxes on the playground equipment. Madison Learning Center offers the services of early childhood education with wraparound care because we are open from 7 a.m. to 5:30 p.m. We also offer before and after school care, as well as full day care for school-age children during school holidays and summer break. Madison Learning Center serves breakfast, lunch, and an afternoon snack, and participate in a CACFP program, that's Child Adult Care Food Program, that is underneath the Department of USDA. So we serve USDA qualified meals and snacks. Madison Learning Center is a fully licensed child care center, and currently all child care centers in this state are now licensed by the Department of Education. Our current enrollment is 51 full-time children, and our current staff is 18, which includes both full and part-time staff. The funding for Madison Learning Center is provided by tuition, which is directly paid by the family or through a child care subsidy program through the Department of Social Services, which can also include a copay from the families. Along with tuition, the center relies on donations. Donations have been received from individuals, local businesses, several churches, churches' men's groups, civic organizations, foundations, and fundraising. Madison has also received in-kind services such as painting, other maintenance, repairs, and supplies. Many grants have been applied for, and some have been received. Madison Learning Center is very grateful for all the donations and for being able to be a site to receive the benefits of Madison Day. And Madison Learning Center also participates in the Northern Piedmont Community Foundation Day of Giving. And as a note, as a board member on a nonprofit agency, myself and all the rest of the board has no financial interest in the Madison Learning Center, nor can obtain any financial gain from Madison Learning Center. And to answer the question before it comes up from the board or anybody sitting here, yes, child care is expensive. Yes, it is. It's a very labor-intensive service, not unlike nursing home care. Our child-staff ratio is based on the age of the child and is mandated by licensing. Many times, for the benefit of the children, we drop that ratio based on which class we're talking about. With the recent raises in minimum wage, the cost of salary has sometimes increased upwards of 40%. And ask anyone employed in childcare at MLC or anyone else, working in childcare does not bring you a very large paycheck. Along with the increases in salaries, there's been increased costs of food, supplies, utilities, and insurance, to name a few. The pandemic hit our community just a few months after we became our own nonprofit in the spring of 2020. The center was closed for 10 weeks with no income coming in. Thank you, Northern Piedmont Community Foundation, for helping us during that time to keep the lights on and the bills paid, even though we were not receiving any tuition. When Madison Learning Center reopened, we only had 16 children. The enrollment slowly began to increase and staff was brought back in. When we did reopen, we had added regulations from licensing and CDC. The number of children in each room was capped, how far apart we had to keep the children, excess cleaning. Our children could no longer be taken directly to the classroom by the parents. That meant another staff member had to take them. And we also added school-age children to our all-day enrollment so that they could do their virtual learning. And thank you to the Board of Supervisors for getting us funds to pay for individual desks for the school-age children so they could work on their virtual learning and sit 6 feet apart. These added regulations increase costs for things such as cleaning supplies and difficulty in finding staff. All of this put quite a strain on our budget. When pandemic funds such as the payroll protection plan begin to come in, they were used to supplement our income. These funds are very, very close to being spent down. Madison Learning Center recently had to approve a tuition increase that will go into effect November 6th. I believe that's what's up on the board. To say the least, this was a very, very difficult decision to make. It's very hard for families to find childcare and then to have to pay the kind of fees that it takes to run a childcare center. It was a hard decision for the board to make. But with the pandemic funds diminishing and no other state or federal programs on the horizon to assist Madison Learning Center, or quite honestly most any other childcare center in our state, the decision to increase tuition, the decision to increase tuition came down to we increase the tuition or we close the doors. So why am I here tonight? I come, one, as a citizen of Madison County, recognizing how important it is that this county have a fully licensed child care center open to the families in our county. Just like many of the other services we have here, Madison County needs a fully licensed child care center, and Madison Learning Center is that. As an advocate for the children, the families, and the staff at Madison Learning Center, I am asking tonight that the Board of Supervisors to please consider assisting Madison Learning Center as we all work to bridge the gap between the pandemic funding and getting our enrollment back to where it needs to be. So with the tuition that's brought in and the community donations, grants, and fundraising, Madison Learning Center can continue to provide the services of early childhood education and child care. Thank you.
Thank you, Ms. Lacy. Thanks for the update. Did anybody on the board have any questions for Ms. Lacy at this point?
Yes, sir, I do.
All right.
Mr. Vice Chairman, just a few questions to help clarify some of the statements Ms. Lacy made, and I'm not sure she would have these figures off the top of her head, but based upon your revenue sources, what do you know what they are by percentage? Sorry to make you get up again.
To be honest with you, I did not come tonight prepared with figures in my head.
Oh, that's fine.
I just came, so repeat what percentage?
Of those income stream categories that you mentioned, tuition and of course the grants and social service subsidies, donations, I'm just curious as to what the ratio is from each of those sources to total income.
Subsidy is included under, we receive tuition.
Okay.
I just pulled it out that way to let you know some of our families are paying full price. Some receive assistance through the Department of Social Services for the tuition. That's called a child care subsidy.
Okay.
And when we have the funds, we will also offer an in-house tuition assistance. So that all comes under the umbrella of tuition. Normally, I would say, and this is off the top of my head, that tuition we hope covers 75 to 80% on a good day.
And then another question I have, because being involved with Skyline Cap and being privy to some of this information, it's still not completely clear, but what other services are offered in the county that duplicate any of your services?
To my knowledge, there is no other fully licensed child care center in Madison County.
Okay.
Head Start serves families. They serve families until, what, 2:30 in the afternoon?
Right, yeah.
The children can go to a pre-K program at the primary school, which is through Virginia Preschool Initiative. Those children, the wraparound care for those children comes back to us.
Okay.
They can come to us at 7 o'clock in the morning, get on the school bus, go to the pre-K program, come back to us. We serve them an afternoon snack, and then they can stay until their families can pick them up.
What are the age groups served by the Virginia Preschool Initiative? How young?
Yeah, to my knowledge, right now, the only Virginia Preschool Initiative program in Madison County is the pre-K program at the primary school, and those children need to be 4 by September 30th for the pre-K program, because they need to be 5 by September 30th for the kindergarten program. We serve children, our license reads 6 weeks of age to 12 years.
Okay. All right, well, thank you for that information.
Thank you.
Clarifying that.
So the Virginia Preschool Initiative, VPI program, there are some counties, I believe Orange and Culpeper are doing 3 and 4-year-olds now. Madison has been approved for 3-year-olds, but I'm assuming they did not have the money in the budget to start that in August. I don't know that
If
for
I
sure. I
can
just
add-
know that it's a match
If I
there.
can add to that, Mr. Yell.
Yeah.
We received notification that the program through VPI to place children in a private, fully licensed child care center had been approved.
Right.
But we did not get this knowledge soon enough to effectively put the program together. And what that means is VPI provides services for children who are 3 by September 30th of that year, and they are placed in a private, fully licensed child care center. But it is still part of the Virginia Preschool Initiative. So our center has been approved for that, but we are hoping to look into that possibility next fall.
So for transparency, I am on the board of the Learning Center, so I have, over the years, recused myself from voting on anything. And I am also the finance director at Skyline Cap, which has the Head Start program. So anything else? I think, Chairman Jackson.
I mean, getting the question by Ms. Lacy at this point is whether we would accept a consideration to fund the Early Learning Center as well as other nonprofits and during budget season. And then that would give Ms. Lacy and the Early Learning Center enough time to identify potential other revenue streams to enhance and continue the services that they are doing currently, and if not more.
Yeah, I agree with you, Chairman Jackson.
Yes, I'm just asking the board to consider helping us as we make this transition from coming out from underneath the pandemic to where maybe we can get ourselves, our feet back underneath us.
Right. So during budget season, there's a lot of requests of the board that are relatively simple. You know, they come in, they go, well, we need $5,000 for this widget or whatever. There's more moving parts to this. I mean, you started, Mr. Jewett, on a lot of the questions. You need to look at their budget, see what the break-even point, you know, where the funding coming from. You know, there's a whole gamut of things. So I would suggest that sometime prior to the early February, when we start getting into the budget, that perhaps, well, let's see, Charlotte, oh, that's right, you'll be gone in February.
No. I mean, isn't the question, in the other part of this is that, like many other groups, we can assign some people as we get closer to the budget season and kind of start understanding the funding needs that they have. And then, I mean, might as well have mass. The worst that we can say is no. And that doesn't put them in any worse situation than they're at currently. And we can identify some folks that can work with Miss Lacy and her team to try to figure out where they need to be and what the request to the Board of Supervisors should be.
Right. Yeah, that's what I was going to assign Ms. Hoffman to. If she would be willing to, well, you can still do it if you don't mind.
I have 3 months.
Yeah. Okay. Yes.
What I wanted to add, Mr. Vice Chairman, is I believe the applications go out and are accepted beginning December. So before the board, well, we'll be talking budget schedule at some point, and you all can give guidance and ultimately approve. But generally, the applications for requests, that nonprofit area you mentioned, sir, would be in December. So certainly, I just want to point out that timeline tonight. That way, Ms. Lacy and her team can understand and be gathering. Maybe there's questions that come this way or from the board there, but certainly maybe working on that earlier, and that December timeframe would help with your application request.
That's one of the main reasons I'm here tonight, knowing that this comes up again the first of the year, and we really do not fall into the category that many of the other nonprofits in our county do. For one, as I'm sure our budget's a little bit bigger than some of the other nonprofits. So being a nonprofit business puts us in a little bit different category, and the timing is why I chose to come this evening.
Well, thank you. Anything further on this, Chairman Jackson?
No, I think this is one that will just kind of roll itself out.
Okay. All right. Thank you very much.
Thank you very much.
So those of you who were here on the behalf of the Madison Learning Center, we will not, you may go ahead and go home unless you want to stay for the rest of the exciting stuff. All right, the next item on the agenda, we have a public hearing on the Rappahannock Electric Cooperative easement. So, Mr. Wright, if you would kick that off for us.
Evening, Mr. Yao. So the first thing is for REC, we're kind of doing two things at once here with Hoover Ridge, which is the fiber hut and then REC's easement. In regards to REC, I'll tell the board that we're not quite ready for board action on this, in my opinion, but we're getting close. We hope to have this thing finalized today, but I'm going to recommend that no action be taken on it. So, in short, it's this is an easement, 15-foot, no cost, possibly, or maybe it will be, depending on how far it is. The history is we thought this was going to be fairly straightforward, and we're close, but we're just asking for a little bit more time. We're working on finalizing the easement and what the scope of it's going to be, and we've essentially just requested more, there's a little bit of language that we're going back and forth on, and then a more detailed map for Exhibit A on that.
All right.
If, Vice Chairman, if I may
Yes.
add, Kim, can you go to the last page of the REC easement document? I'd like to bring that image of the sketch that Hannon's referring to. And thanks, we do have our wonderful cooperative folks in attendance tonight. So just a visual, many of you probably are aware, obviously, where Hoover Ridge Park is located, but more importantly, recently, the board approved and it's been installed is the new radio tower that is located at Hoover Ridge. So when you look at the middle of the exhibit before you, it kind of looks like a river flowing through. That represents the access road that runs through Hoover Ridge Park and goes by. If you stop your pointer, Kim, at the kind of dark square, that is currently where that road would veer off of the main road that goes into Hoover Ridge that goes to our tower site. Here shortly, your next public hearing, Mr. Wright will speak to the communications site lease agreement, which was with Firefly. So in order for this connectivity and for this proposed, I'm saying proposed until you all decide on the fiber hut location, there will be a new easement that would need to be recorded or approved first and foremost and recorded for REC. You see the dotted line that runs up to the right. REC already has, that is their major line that runs from the substation and continues on north. So you've seen those bigger three-phase lines that run through. So there would be a drop that comes from that area running back towards the fiber hut. If you're familiar with the ditch line that runs along to the left side of the road, if you're passing the access road towards the power line, just think of 5 feet in, or about 7.5 so feet in off the ditch line. In Rappahannock's, most of the leases they have with us, even looking back at the one that was filed in June of 2022, when power was ran to that site from a transformer to the tower, 15 feet is a normal easement for them, and that is represented by center line of that utility. So 7.5 feet either side represents the 15 feet. So I just want to give you that visual. As Mr. Wright has stated, both our council and REC's council are just working through some of that final language that's separate from your closed session item tonight, which is the conduit license you will be discussing. But there is some additional work. So just wanted to give you a visual. If you have any questions on that front, I think Mr. Wright has clarified it, where we're at in the stages. And I believe maybe look to bring this back by the 10th, the October 10th meeting is the first meeting, or would that be too soon, Mr. Wright, or?
Trying to do the math of the advertising in my head.
Yeah, it'd be tough. It's gonna be tight.
Yeah.
It'd be tight.
So maybe the 24th, the meeting on the 24th.
That could certainly work.
Okay.
All right, any questions from the board to Hannon? Oh, Mr. Wright, I'm sorry. Well, since this is the public hearing, is there anybody in the public that would like to comment on this REC easement at this point? Very well. Nothing over there, right, Al? Okay, so back to board. I think we're being advised by council to table this, so I think we ought to do a motion to table. So I would entertain a motion to table the REC easement.
So moved.
Second?
Very well. We have a motion and a second to table approval of the REC easement. Any further discussion?
Mr. Vice Chairman, is there
Yes.
a timeline on this motion, or is that just dependent upon the resolution of the issues with the Eaton County Attorney and REC?
I'll amend my motion to include on the, what is the second meeting, the 24th?
Yes, sir, Mr. Chairman.
There you go.
All right. Thank you, Mr. Jewett.
And I'll
Your
second.
second to that? Very well. Any further discussion? Hearing none. All in favor say aye. Aye. Opposed,
Aye.
nay? Chairman Jackson voted aye. So, all right, we go to Firefly Communications Site Lease. There's a public hearing for this one as well. Mr. Wright.
Yes, sir. So this is between CVSI, Central Virginia Services, Inc., also doing business as Firefly. This is a 50-year lease for 3/10 of an acre over at the Hoover Ridge in order for them to construct a fiber hut. This is a no-cost lease for use of this parcel. Idea being it'll allow more fiber connectivity across the county. And it requires certain obligations in terms of safety, following state and federal law, and allowing county access to inspect the premises, and also has insurance requirements, all those in place to protect the county. There are some slight variations from the packet, and that is real simply just for insurance. It's got to change the insurance requirements. Instead of automatic, it's just upon request by the county. And then the other one was, and this was at CVSI's insistence, which is that we're not allowed to terminate this lease without cause. Reason being is they're laying out certain expenditures in order to construct the business. But if the lease is terminated, then they still have an obligation to return the parcel to where it was, unless we agree otherwise. So those are the only changes there, as well as it adds who notice should go to on behalf of CVSI. But otherwise, it's as is in the packet.
All right, thank you.
And just to add on that further, Mr. Vice Chairman, and for members of the public, Firefly, or their RISE project, which we know has kind of been trimmed back since the 2021 Batty Award, and there were some RDOF challenges. But this is the backbone, essentially, to allow fiber to come into the county and be deployed. So I know we've had discussions in the past, and just want to raise that point to the general public who may or may not be tracking that. This is a centerpiece of that. So normally when you think of leases, you think, hey, revenue or some forth there. But the importance of getting Firefly going, the community has been waiting a long time. We're still trying to get these other pieces of the puzzle that are non-related to Firefly commitment of broadband. But I just want to specify again to the board and the public as well that this fiber hut is the backbone, if you will, to get the fiber out as part of the Firefly project.
Questions from the board? Anything on this? Very well. To the public, is there any public comment on this Firefly Communications site lease?
You have a drawing? Is there a drawing?
There's the map is on there, not of what it's going to look like, but of where it will be.
Yeah, that was basically in the same map. Where's that?
That's the location, but I can get a schematic.
One more.
What I
Show
believe
'em that
Mr.
little-
Linhoff is asking for, whether it's a communication tower, like the radio tower we are having construction drawings for in Etland. Similar, there's a site layout that shows the actual lot on the site as well.
Brian Linhoff, Madison County resident for 40 years. Need broadband, please. But 30 feet, that's huge for telecom. Normally, a hub has a footprint of maybe 20 by 20. Why do they need 30 feet?
I'm going to send this to Ms. Turner. I don't know if you're going to be able to pull this up fast enough. This is the Exhibit A to the. I think it's the HUD, plus they're going to have a generator, and then they're going to have a propane source also. It's all part of the same footprint.
So basically, they're asking for this is basically like a cell site footprint. Okay, I understand.
All right, thank you, sir. Anyone else? Very well, back to the board for a further discussion or a motion.
Mr. Chairman, I move to approve the Firefly Communication Site lease.
Second.
Very well, we have a motion and a second to approve the Firefly Communications Site lease. Any further discussion? Very well, all in favor say aye.
Aye.
Opposed, nay. Motion carries. Thank you. All right, let's see, next item on the agenda, old business, Leathers Lane update. Mr. Wright, you're still up.
Yes, sir. Just to update the board from the last discussion is some cease and desist letters to go out for the board's direction. And what I'm doing, I'm actually doing it in conjunction with Mr. Gregg, because he's got some historical knowledge on this problem set. But what I intend to do is have sort of a course of action options for the board to consider. I'll send that to you within the next few weeks, but to give you sort of a read ahead on what your options are. I mean, of course, there's status quo, and that was based on, after a lot of thought and research, that position paper to essentially ensure that the county has no responsibility or cost associated with Leathers Lane. It's an all or none for the neighbors. It's got to be unanimous in order for them to improve it. And the idea is to try and force some cooperation there that they come up with. I know some of the members of the board talked about a supermajority. There's nothing legally stopping us from adopting that. But I would, and I can explore this further, and this is for discussion, it may begin us going down the road of managing this, and that would carry certain responsibilities and even potential liabilities. Just certain thoughts are, you know, who's going to govern the votes, who's going to govern who's going to do the work, who's going to collect the money, who's going to supervise how the work's going to be done. So again, turns us into the super HOA for this development, which we're trying to avoid, I think. Another one is abandonment, we'll talk more about. It's certainly an option for us, but it does mean that we wash our hands of it, and what other problems are we creating by doing that, and what control, if any, that we have now do we lose by essentially surrendering the property to the property owners there. Another one is to sell it and do that via request for proposal. That's an option that we can consider. Certain conditions that we'd have on the sale in terms of what the road quality would be and who would access it. Of course, everything's got some problems that comes with it, so we'll talk about those, about, you know, who the purchaser would be and how much vetting we're going to do with that, and then a new question of enforcement if that person's not living up to what it is, and I think ultimately also is there an actual marketplace for somebody to purchase that. You know, we've also talked about the special tax district. I think I've read it'd be about $500,000 to create that, to get this up to VDOT standards in order to turn it over to the state. And then another, and you know, you might call this a half measure, but maybe this is a step up in terms of a gap filler. Is we create a county ordinance as opposed to the state code about what constitutes allowed action and who can do it and who can enforce it. You know, and it could be escalating a fine situation, or you know, even make it punishable by jail. Do we want to make it so citizens can sort of enforce it against each other? Anyways, those are going to be some of the options that are going to be proposed or offered to you.
All right, thank you. Questions for Mr. Wright?
Mr. Vice Chairman, I have one, and this is something ongoing part of the discussion. Just a clarification, under the current rules, it requires unanimous consent to make changes. Now, if that consent is given unanimously, then the responsibility for funding any changes, that's essentially voluntary on the part of the members of that community, correct?
That's right.
So that would not, if we were to say change that to supermajority, that would not change, that situation would not change.
That part, you're right.
Okay, thank you.
Anything from anybody else? So, so this was discussed, what was it, last meeting? These, they start running together, but we asked Mr. Wright and Mr. Weekly to present us with options. So it sounds like we now have 5 or 6 options, more than we had talked about last time, so I appreciate that. So I would say that, you know, if you would continue to vet these options, give us the pros and the cons of the options. Like you say, there's a pro and a con, it seems like, to every one of them. And we will take this up. Think we get that by this?
Get feedback from council if we may.
Yeah.
Mr.
Let's do it.
Yao, what's fair timing?
I think, could we use that same October 24 date?
Yeah, the second meeting in October.
I think, Mr. Vice Chair,
Or-
I think the strategy would be, you would do some type of memo that would further developed. You'll see those options that Mr. Wright has spoke to, and then hopefully from there, you know, maybe you can provide direction and, you know, we'll go down that route. But, yeah, I think the plan was more of a memo form.
Tonight.
And something we would share with the residents when we have that, and let them know that it's on the agenda.
Mr. Chairman, you got anything?
Every one of those options is not good. There's no silver bullet here at all. The only one that we haven't ever talked about in any kind of capacity, and I think Hammond hit the nail on the head, is their marketplace, is selling the dang thing. I don't know, maybe, we're not real good at selling things up in that part of the world. But I mean, I don't think that even on the 24th, getting it back, there's a whole lot of, I mean, it's kind of a, I hate to say it, but it's kind of a play it by ear type of situation,
All right?
unfortunately.
Yeah. All right, thank you. All right, so the next item on the agenda is community paramedicine presentation. Chief Hillstrom and Tiffany Ranabarger. Please.
And Chief Hillstrom will also introduce, we have our wonderful OMD here tonight. So Dr. Rames is here with us, as you may recall. We transitioned starting September the 1st, so we welcome you, Dr. Rames.
And the OMD is what?
Operating
Operations
Medical Director, which is required for any EMS to operate.
Thanks for being here, sir.
Good evening. I tend to speak very low, so I'm going to try to adjust that appropriately. I'm Tiffany, for those of you that I haven't met yet. I'm ashamed to say that I don't think I've met several of you. I've worked for Madison almost 2 years now. One of the things I wanted to speak about tonight was mobile integrated healthcare, which is a form of delivering community paramedicine. So these are just 5 questions. I'm not going to ask you to put up your hands. I'm going to put up hands just to show that this can potentially affect anybody involved in any community. Have you or someone you know ever had any trouble navigating your health insurance? Have you or someone you know ever had trouble getting a doctor's appointment, a specialist appointment, or a mental health care appointment? Have you or someone you know ever struggled with getting transportation to work, school, childcare, or to the doctors? Have you or someone you know had trouble knowing where your next meal was coming from? Have you or someone you know had a hard time understanding a new diagnosis or navigating the next steps after a new diagnosis? These are realistic questions that unfortunately a lot of people in our community face every day. Next slide, please. So I've just outlined some terminology here. Mobile integrated healthcare is used interchangeably often with community paramedicine. For those of you that don't hear those terms often, you can think of mobile integrated healthcare as kind of like a car dealership. We have a lot of them on the road. They all sell different specialized vehicles, but their main goal is to address the needs of the consumer. So community paramedicine could be a Subaru or a Toyota dealership. They have specific modifications for their vehicles for that specific consumer, but they fall under the umbrella of mobile integrated healthcare. EMS is emergency medical services, GDP, the gross domestic product acronym, and then WHO is World Health Organization. Some evolving issues I'm sure you guys are more familiar with than most, since you do a lot of the budgeting and supporting accounting. Medical costs are rising just about as higher actually than inflation. So medical access is a huge issue. And when you have mounting costs, that access tends to go onto back burner. So we spend as a nation more than any other industrialized nation on healthcare, but there are 29 countries that outrank us that are also as developed as we are. In the last 100 years, the top 10 leading causes of death have not changed despite the amount of money that we spend on healthcare. So why is this important, right? Primary care is one of the biggest avenues to access care initially. When you don't have that foundation, a lot of things change. We have OFMP, the Madison Primary Care Physician Office, that is probably at their capacity. We also have a free clinic, which also offers a significant amount of services. However, with our population, our ratio of providers to patients is about 4,400 to 1, which is quadruple what the state level currently is. Primary care in rural departments is extremely hard to get. There's a lot of physicians that don't want to come to rural areas because you have a high population of Medicaid patients, which means your income reimbursement rate is going to be significantly lower. You have basically a lot of work for a low compensation. So it's not exactly something that draws a lot of people to the area. They are starting to address that initiative on legislative fronts as well as different grant funds, but that's one of the biggest issues I personally see with the Madison residents in the county currently. So primary care matters. We spoke of accessibility. There's plenty of evidence-based medicine to show that that's your first line of defense against any chronic conditions or illness and injuries. A lot of people that don't have that foundation don't grow up knowing, hey, there's immunizations you're supposed to get every year. You should get a flu vaccine, and that kind of ends up getting pushed onto kids. If they don't grow up around that environment, they don't understand the reason for preventative medicine. 50 years later, you have people that could potentially die from not getting pre-cancer screenings from something that's preventable. Treating a condition in an ER costs 12 times more than just visiting a primary care physician. With that being an issue in Madison County, that severely limits the ability for the patients here to get a lot of care. And that's one thing that this program would work to address. So in fire and EMS, you pay for the cost of readiness. It's extremely important to have our units available. I pulled the numbers from last year in 2022. Out of the 1,601 calls that we made patient contact with, approximately 305 of them did not result in ambulance transport. And please don't mistake my description that we don't want you to call 911, because I absolutely want you to call 911. That's what we're here for. My point in pointing this out is that the amount of time spent on those calls is equivalent to taking an ambulance out of service for 13 days straight and giving 2 full-time employees 6 weeks off paid leave, as well as $1,100 in fuel cost. So why does this matter? because the majority of these patients in that 305 had unmet needs, and that's why we're going back out to them. That's what we're here for, is to address the need, but if we don't do that properly the first time, we end up going back out to them, and that's where community paramedicine comes into place, and that's why it's a huge concern. Last fall, we got dispatched for a welfare check. For those of you that don't know what that is, if you have a loved one or a family friend member you want to check up on, but you don't live in that county, you can ask the police to just go out and check on them. This specific call was initiated by a postal worker who was very familiar with the patient. The patient would walk out and get his mail out of the mailbox every day. So after 3 days of mail piled up, he got concerned and thankfully called the police department. When we went out there, we found a gentleman in his 70s who had been on the floor for 4 days. Something that should not happen today in medical care. What we would learn in the future is that the reason this happened is because his wife, who was his primary caretaker, he had a history of dementia, had fallen and broken her hip. And that placed her into a nursing rehab facility. No one thought to ask who was going to take care of the husband. There is an immense need. I'm so sorry.
Take your time.
For the aging population and vulnerable adults in this county, and not having a primary care foundation directly affects everything. And as a provider, it personally affects me because you hired me as a resource to this community. So yes, I'm a paramedic and a firefighter, but I'm a resource. So if I need to be a social worker to get you whatever help or resources you need so that you don't have to be found on the floor after 4 days, then I need to do that. In doing this research for this project, I had the immense benefit of speaking with a lot of the community organizations. And I can tell you that they just speak to what an awesome county Madison is. Because when I sat down with them, my question was, okay, what do you see? I know what EMS sees, I know what we see on the scene, but in order to figure out the best root cause analysis to proceed forward with a project of this nature, I want to know what we're missing. And not one of them refused or said they were too busy. Most of them have double caseloads of work because staffing is an issue all over the county. And every single one of them stepped up and was like, hey, this is what I think would work. This is what we're seeing. This is what would help with improvement. I have an immense amount of coworkers that have the same exact passion as me. We see it every day. It could be something as small as someone doesn't have batteries for their glucometer to check their blood sugar, so they can't properly monitor their blood sugar. We had an individual that was not told by his primary care physician when he was prescribed insulin, you should eat before you take your insulin. It's a very simple fix, and it's literally a 5-minute conversation. But when these things don't happen, there can be catastrophic results. How can we do this? A community paramedicine program gives us a care delivery model to execute after having collaboration and innovation to be able to create what is best for the community. Every community is different. There's about 14 different programs already in place in the state of Virginia that range from addressing substance abuse disorders to fall prevention. It's directly correlated to what your community health needs assessment is. After speaking with VDH and doing an immense amount of research that goes back to basically primary care efforts and bringing care access to these patients. So essentially, this day and age, it would be equivalent to an Amazon van to a patient's house so that we can have a doctor that can virtually assess them and we can do the physical assessment and help appropriately facilitate whatever that may look like in the process. This kind of changes our initiative from being reactive to proactive. 911 and first responders and providers, they have that education around the clock. It's not just when you call 911. We get excited when you call 911 because we get to use it, but that education and that want to help people is always there. It doesn't change, and we would prefer to be able to address it when we see the need rather than 6 calls later when now, because we didn't address the fall prevention or the throw rug or the huge hole you have in your house that you can't afford to fix, so now you have a hip fracture. So Our goal is to try to combat a lot of those increasing needs in the future by just doing the simple fixes. You just allocate your resources appropriately. In doing so, a lot of times these needs can be addressed with one person in a vehicle. So that ambulance that would be on that lift assist, now we have someone out there figuring out, okay, why are we lifting you up off the floor? Is it because your bed is 6 inches shorter than the wheelchair or taller than the wheelchair you're trying to transition to? If we have someone that can either A, get you a hospital bed, or B, a better way of transferring and work on that ability, now we have an ambulance free for an emergent need that may arise, and you've done it at half the cost. Staffing would be completely reliant on the model that you would choose for delivery. Right now, we are short-staffed, as I'm sure you're aware. This can kind of affect both methods of that. I can see the aspect where starting a new program is a bad idea because you have current needs. At the end of the day, our biggest obligation is 911 calls. That cannot be faltered. In order to get buy-in from the state and ultimately certification to have a program like this, you have to be able to prove this is not going to affect those 911 calls, and that's not our intention. Our intention is to be able to have a supplement to have our crews readily available as well as address these underlying needs. EMS was built on the premise that if we get you to the hospital, that's our end goal because that's ultimately what's going to help you. Well, that's no longer the only or the best option for the patients, and we've recognized a lot of this. There are a significant amount of grants out there that would support this effort, as well as partnership with a telehealth agency, local community health agencies. Honestly, initially, it's extremely inexpensive, a tough book. We have a quick response vehicle currently that we could use, but the goal would be to support these tangible resources by nonprofit support or grant funding in the future. Sustainability is a big thing. There are a lot of insurance companies that are actually already reimbursing for this process. There are currently 11 states that have private payers on board, which is Anthem, Blue Cross Blue Shield. Virginia is one of them. There are 11 more states that are joining the Medicare, the whole CMS group, Medicare and Medicaid, for reimbursement. That was supposed to start this month. However, that got pushed to January of 2024. But currently, they already have 8 different states with 25 different EMS systems that are working through Medicaid to deliver the care to these patients in their houses. So the biggest thing the residents are getting, if you have a patient that maybe we take to the hospital that doesn't have insurance and now falls under a private pay, if it's a matter of them just getting an application filled out and we do that for them because they don't know how to read or they don't know the process, now they have insurance so they can get medical care in the future and it's not a cost the county has to write off. Initially, we wanted to focus on medication review. 70% of the people over the age of 50 are on at least 2 medications. A lot of times that can be confusing. We have a lot of population patients that we take that have the spouse, husband and wife medications together in a shoebox. Some of those are expired, but this is not something that's typically evaluated at appointments. So it's something we could address at a home visit in 15 minutes that would drastically improve the health of the patient. Home assessment is another thing. You don't have to be an ALS provider to do any of these things. Community paramedicine does have paramedic in the name, but this is something that kind of fits everybody that works in our agency. The potential for future initiatives is exorbitant. There are different chronic diseases you can focus on, but again, this process evolves based on what the community needs as a whole. Our biggest goal is to basically figure out what that unmet need is by those ambulance transports. Like I said, I have no problem going out and meeting these patients and picking them up off the floor or figuring out whatever they need. But if I'm just tucking you back in bed and you're going to fall tomorrow, then I'm ultimately doing them a disservice. And that pretty much is the majority of it, I believe. There are some letters of support for some agencies that I've collaborated with in the process just to figure out what their views are. Is there any questions I can answer for you?
Questions?
You have one?
Yeah, I do. Go ahead.
Y'all go first.
Go ahead, yeah.
So you said something about repeat falls. Is that something that happens regularly?
Yes, sir. So out of those 302 calls that we went to last year, 17 of them we had been to at least 7 times in 2022.
Wow. Thank you.
Yeah, well, I guess a decision needs to be made. Somebody calls 911, and then 911 operators, it's going to be on them to decide whether they need the full ambulance unit sent, or a paramedic, or, you know, how would one decide who needs to respond and at what level?
Absolutely. So in an urban system, that would absolutely work well. They have nurse navigators. That's exactly where that decision point starts.
At the 911 center?
Yes, sir. In a rural area, that wouldn't be very feasible. We would work basically based on referrals from hospital discharges. So we would do follow-ups, referrals from crew members. Hey, I was at so-and-so's house. They need a ramp. They don't have steps to get out of the house. This is a concern, and we would do what we can to address that. A lot of those future appointments would be just that, contacting the patient, saying, hey, I would love to come out and speak with you and figure out what else I can do to help you. And it would be an appointment like that.
Yes, sir. Yeah, absolutely. You can take that mic off there, Noah. Oh, there you go.
So just to address that specific question, if you call 911, we have medical guidelines that are in place, and almost 100% of the time, you're gonna get an ambulance service out there. That's reactive 911. You call, we react, we come out because there's an emergency, we don't know what type, and sometimes we don't have enough information, so we're gonna go out there. What Tiffany's proposing is proactive. We start to gather data. We recognize folks that call very often. We go out to their homes, assess what's causing these repetitive calls, how can we prevent this? Do you need access, a ramp into your house? Do you need the stairs repaired? The AC unit doesn't work, you know, something of that nature, so that we, again, mitigate those potential future 911 calls. Of course, all of 911 calls would be dealt with the same way. We would restrict or funnel them to a community paramedic. She's specifically talking about a program where folks that are in need but end up not needing the higher level care 911 are identified. We try to address those concerns and again mitigate perhaps future 911 calls. Does that help clarify?
Yeah, I think so. Chairman Jackson, that was Dr. Reams speaking just now. I'm sorry. Questions? Yes.
And this is just a follow-up question. And you mentioned that you would receive referrals from hospital discharge. I assume there'd also be referrals from social services, possibly even the sheriff's department that has to conduct regular well checks. I mean, is this a coordinated, unduplicated effort?
Yes, sir. That's the biggest goal, is to collaborate appropriately so that we don't duplicate efforts. Right now, and one of the biggest thing I saw in speaking with these other agencies is a lot of people have the same goal of helping these individuals and providing them the appropriate resources. But we're all seeing different views of the picture. So the idea is EMS has a different set of skills. We can kind of see exactly what might potentiate an injury in the future or something that needs to be handled right now. And then we act as that navigator to get social services involved, to contact Encompass or somebody else and get them in the pathway, either through education or referral, or do the legwork just so that they can have better health.
Thank you.
Mr. Vice Chair,
Yes, sir.
if I may. First, very impressed. I had the opportunity to sit down with the Lunch and Learn. They say you can't teach an old dog new tricks. I think that has been shattered. You taught this one. Just a few things that stuck out for me. One, this is information for the board tonight. So it's good to stay aware of trends or proper advancement in the medical community, not only in medicine, but how patients are served. So I appreciate when our team is always watching those things. Sustainability would be a question how to do that. That doesn't mean to look past what is presented here tonight. some of the things stuck out to me. You recently had some comprehensive plan data that speaks to your demographics and how folks are commuting out, and how does that connect the dots here? You know, several decades, you'd have families that lived in one another. So I use the patient Bob. There's not an actual Bob, or maybe there is, but I'm using Bob as an example tonight. Bob's fell 4 times. Why doesn't the family member come recognize they've been on the floor for 4 days? Well, there may not be any family members there to do that. So that's one thing. That demographic has changed. So it's something to keep in mind, certainly in talking with Tiffany, making them aware of the sheriff had instituted a welfare check list, if you will, for citizens some times ago. So I do think there's the ability to have a gatekeeper. If we're looking at care, that naturally would fall in line more of EMS than other agencies. However, that wraparound care, which I think may be the proper term, whether it's aging together, social services, you know, who provides a walker that maybe need. If it's a transition strip, some of y'all talked about this example, you know, if a carpet meets a hardwood floor, it's a trip hazard. Maybe Foothill Housing, that's an organization you fund to a certain extent every year. So it's an opportunity to collaborate. The other thing in Tiffany's presentation, as you saw, that there are some states, this is a billable reimbursement. One of those programs you have now is the ambulance billing for, or that was used to be called revenue recovery. Right now, Virginia is not qualified, or they haven't passed that. I think, my personal opinion, not speaking on behalf of EMS or the Board of Supervisors, that I think could move us along should the board desire to explore it further, because I know funding's going to come up. You have to take a position away to dedicate to this, at least from the beginning, if you so choose to do so, and then kind of backfill that. Somebody has to be there to meet our staffing minimums and answer those ambulatory service calls. But from a billing standpoint, if you can get funding to help, whether it's with programs, you saw a lot of equipment and tech and equipment kind of things, not necessarily salary, but certainly when you have more funding funneling in beyond the locality, it allows, in my opinion, the locality to look at it, take a more closer look, because it may make that funding gap more allowable or permissible. And the journal or the medical journals, I know Noah has shared with me, I think some examples from Texas and other areas, that has been kind of the national concern is how do you keep this going? I don't think anyone would say it's not a good program, at least how it's been presented. It's just how do you keep it going when you have shortage of paramedics, nurses are shortage, hospitals are going to scoop up paramedics. So how do you face EMS staffing needs as well as paramedicine? But it also, I think, speaks to having ambulances available. If you have a multiple issue in the county, some of these, it's still concerning, a person is vulnerable, but in those cases, maybe non-emergent, where a community paramedicine professional is going out, and it keeps those ambulatory services here. So great presentation tonight, meant for introduction. Certainly, it would have to meet protocol, procedure from our OMD, if it's something the board wanted to go down. I guess for tonight, you know, where the board would like to leave is, if this is something you would like to explore further, then what I would recommend is we would work together, kind of bringing what that playbook looks like. I heard about, you know, who decides when a call goes to 911. We can clearly define that. We can kind of show you, we understand this would be a growing program, so what those initial steps will look like, but also put some funding behind it so you know the fiscal constraints that may exist. So information tonight, no decision necessary. However, if the board would like to direct staff to continue to explore, to bring a more further developed that has those pieces I just mentioned, we're happy to do that as well.
Yeah, I mean, I guess looking through this, I looked through it extensively this afternoon, and, you know, I've got a bunch of questions which I'm sure you guys can answer. I was hitting Noah up a little bit, so I would like to write up my questions and submit them, I guess, to you, Jonathan, maybe to pass along. And
So, should
pursue.
Yeah,
Yes.
yeah.
Investigation.
And hopefully maybe Virginia will be on the qualifier for insurance at the time, so.
So is that take the act of the General Assembly? Or,
I don't have that answer.
knows?
Could ask.
I'll make note of that question, Mr. Vice Chairman, and get a response to the board.
I can tell you, I would love to go to Washington and just let them know and then inform them that they should support this. Yes.
You may get a wish. Our Congresswoman makes visits, so we can set something up in the near future for their aides to maybe so do that.
Got anything on this, Chairman Jackson?
No, it sounds like y'all are going down the right path.
All right. Very good. Thank you.
Thank you.
Thank you.
All right, so let's see. Next item on the agenda, classification and compensation study. Mr. Weekly.
Thank you, Mr. Yao. Just a little background here. I thought about how would I give background. I know we've had some discussions on compensation, but I thought it'd be a good point to policy. That is kind of administrator is in my title, so I'm administrating your policies that are approved. Per the Madison County Personnel Policy Manual, specifically policy number 4.1, the county administrator is required to annually review the compensation plan and to submit updates and recommended changes to the Board of Supervisors during the budget process. Some of you may recall the last study, classification and compensation study began in 2019. We know COVID hit certainly thereafter. There was decision points made in 2020. Ultimately, it was adopted, found records in April 2021 as part of the budget process. From that, there were good takeaways that staff could use should the board desire to move forward with this classification compensation study. And basically, things that were triggered, in my opinion, there are no earth-shattering things here that the board's not aware of. I mean, the market right now with inflation, competition for attracting and retaining qualified personnel on all fronts, so we're not just looking at a specific group, certainly would be reasons why I would recommend the study. I specified when the last study was performed, that was done by an outside consultant. Staff would recommend at this time, should the board want to move forward, staff would recommend to perform that study in-house. We have identified our study team, I'm referring to them as, should you want to move forward. That would look like our finance director, our human resources personnel, myself, and Ms. Turner to, whether it's collecting data, meeting with department heads. So put forth a timeline. I appreciate Ms. Turner has handed out an actual calendar. I was unable to get that in the packet on Friday, so my apologies. I did put out a bullet point kind of outline of what this would look like, when it would begin, and when we would anticipate ending the study. Some of those benchmarks, one, introducing the topic here tonight to seek board approval and direction. That begins everything. If that were to occur, we have moved from bi-weekly staff meetings to monthly staff meetings. That's a survey we did, and people preferred monthly. So then we would fully introduce this study to staff at the next monthly staff meeting on October the 3rd. We would discuss the methodology used for the study and provide our timeline to complete the study. Encourage department head feedback, and the study team will draft questions for an employee questionnaire survey. So that's the study team collecting that, and then that questionnaire would be issued to all employees, not just department heads, all employees, beginning October the 13th. Part of that questionnaire in the email, they will receive their current job descriptions. We should always be reviewing, engaging to make sure our job descriptions are accurate, and we're asking our team members to help us with that. This ensures that, again, the job description is up to date. At the end of October, we would request and require surveys are due back. Certainly we'll take them before that, but that gives us the month of November to really take all that data, and have some internal discussions to put it into a draft study. And that would include, had already soliciting department heads for some feedback. Just brief pause before finishing out that timeline. Methodology initially would look like looking at mid, max salary ranges currently in the county, as well as surrounding counties. There are counties we have outlined. We would look at, we're hoping that those counties we seek information from will provide us with their tenure in those positions. I think it's a good comparable when we consider our personnel, their credentials, their tenure in that position, as well as that, how it's reflected in other counties. I think that's apples to apples as well. And there may be some additional data. I've had some discussion with a few constitutional offices. Some of them feel like while maybe larger municipalities, let's use Treasure for example, they may have more specialized employees doing certain things. Maybe someone is making the phone calls, someone is handling tax delinquencies, someone's handling another portion. So that's just an example we will certainly take in. As you may recall, the last study also included getting department head feedback. So we just want to make sure everyone has a seat at the table. We will weigh that out, and then we will ultimately meet with department heads. So moving back to the schedule, we'll spend November putting that data together in a draft study. Also from November through December the 12th, we'll meet with department heads to review and discuss the draft study. So you notice that timeline, that's in advance when we would normally meet with department heads to just talk their regular budget. We think it's important to let this study be part of the budget, so it's important to have those discussions earlier on. And then we have marked, and these are just kind of fluid dates, but from December 19th through January 9th, 2024, we would have board review and discussion of the draft study. So there's several meetings and opportunity to do so. I realize that's crossing over to a new year, and your membership may look a little different, but that's our timeline. And then ultimately, February the 13th, kind of that's your time frame. And again, we have to bring a budget schedule to you in probably around late November, early December for you to decide. But assuming you follow past budget schedules, February 13th, we would look to have discussions of the implementation plan and approval as part of the budget process. So what that means is, at that time, hopefully you have reviewed the draft study, assuming you want this to be commissioned and move forward. You will review that. You would give us feedback if you're in agreement to it, making adjustments, whatever. But whatever that final product looks like, then you need to talk about the implementation of it. You know, obviously people are going to see what is that total number. That may affect, you may say, we want to do it in one fiscal year. We want to break it up in two. It's however you wish to do so, but the implementation of it is a key component because people are going to want to naturally know, one, thank you if I am receiving some type of increased compensation, but when can I expect to do that? So it's all about communicating not only with the board, but through you to me, out to department heads and our whole team members. So I know I've said a lot, Mr. Yao, but that is an outline of our approach. Again, none of this moves forward without board authorization. So I'm here to take feedback or any questions or comments you may have. And if not, sir, there is a recommendation action should the board desire to do so. That's in the board report.
Well, Mr. Weekly, it seems the timeline seems to me to be pretty well thought out. It's looks reasonable, and I think it's something we definitely need to do. That was obvious from the last budget session that we went through, and a few other things that have come up throughout this fiscal year so far. So
this is absolutely great. I'm sure everybody remembers the last time we went through one of these and we used an outside group. Their timeline was nowhere near as concise, and they came in and told us how qualified they were. It also cost us a tremendous amount of money, and I think it got very, very close to 6 digits. Doing an internal for a plan that works, that is our plan, done by our staff, should provide just invaluable amounts of data moving into this upcoming budget year and then future budget years, kind of to work off this and not make it something that is obtainable for the taxpayers.
I agree. Anything further from the board? All right, if no further discussion, entertain a motion to authorize the county administrator to complete the classification and compensation study.
So moved.
Yes, second.
Very well, we have a motion and a second to authorize the county administrator to complete the classification and compensation study. Any further discussion? Very well, all in favor say aye.
Aye.
Opposed, nay. All right, we got your vote, y'all here. You got Clay's vote, okay. All right, let's see what we got. There is nothing under discussion, under information correspondence. What do we know about the state budget at this point, Mr. Weekly?
We basically know they passed one. Thank you, Mr. Vice Chairman. Just my update for this matter is two things. One, we know via the state budget approval recently that will have some impact to schools. What we are currently looking at, and staff will be meeting with school division staff in October, is to unpack that. And what I mean is, yes, I can clearly read there's a 2% teacher salary increase. We want to know what funding's coming from the state, how do they plan on the programming it? Is it teacher, or is it beyond that? So we'll have more information on the school side in October. Recently, I received a budget or a memo from the compensation board. That's usually the group you hear from for our constitutional or our comp board positions. Think of treasurer, commissioner of revenue, commonwealth attorney, sheriff's office, and so forth. That there are salary increases approved as well. That memo indicated that there is more information to come in October. So my thought after talking to Ms. Warren is we'll have our meeting with school division staff in October. We will have conversations with the comp board, and certainly thereafter, soon thereafter, we will be coming to the board to give an update of what we understand. If there's any, certainly we hope to have detailed funding streams we can speak to, and then lay out some options you may have, and or certainly staff always tries to give a recommendation, so we're offering something up. But it is mid-year. We'll see what that impact is, but there's still a lot to determine. What I do know as far as timelines with school funding, I've seen a lot point to implementation in January 2020. Again, we need to know what funding's coming in, how it's going to be expended, but that's the time frame I saw for the schools. On the compensation board side, I saw an implementation date of December 2023. So either month is approaching us very quickly. You hear me say in October we're going to be learning things. That's not much turnaround to flip a switch. However, we will work expediently as possible when we have the information to bring it to you at the very next available meeting. And you certainly will get emails in advance and have some discussion before those meetings so we can answer any questions as we prepare for that board update.
But obviously, we won't get as long as the General Assembly took to get it to turn this around. So. All right, thank you, Mr. Weekly. Okay, so we're back to public comment. Is there any, it's a second public comment. What do you got, Alan? Oh, yeah? Oh, sure, yeah. Do so.
I know my name has been used before, but I am Dr. Matthew Raines. I'm a residency trained board certified ER physician. Been working in ER since 1997. It's harder to say. I still work in the emergency room. I live in Culpeper, just down the road here in White Shop. And I'm also the OMD or operating medical director of Culpeper, as well as many of their volunteer fire departments. Noah came to me and asked me to come on board, and I know this podium is typically used to criticize your decisions or ask for money, or both. I'm here for neither of those, in fact, quite the opposite. I met Noah, I met the EMS team, I saw their resources. The resources are limited, but they're excellent. So you have very wisely invested in your community EMS system, and they in turn have used your dollars very correctly. I would say that their limited resources are top-notch, and they deliver excellent care. They delivered a patient to our emergency department last week. The nurses were very impressed. The patient was intubated already on the correct blood pressure sustaining medication, and basically they just continued the care that Madison had already started, and again, an excellent run by Madison. So again, I'm not here to criticize, I'm here to thank you. I think the board has made great decisions. In fact, when I asked Noah, why is your department so well run, he said, the Board of Supervisors really supports us. So my hat's off to you. Secondarily, I'm not here to ask for money. I know that there is a yearly stipend given to the OMD. I've instructed Noah that I will rescind that, and I would like that money reinvested back into the EMS department, which he already has, so don't ask for it back. But my faith and my compassion for this, I think is a good use of charitable works, and I'm happy and very proud to be your new MD here for Madison. Thank you.
Thank you, sir.
Thank you.
Anyone else? Yes, sir.
Good evening, I'm Mark Ponton with Rappahannock Electric Cooperative. I'm the Director of Fiber and Broadband Services. And for a couple of minutes, just to address a couple of questions that were asked. One was concerning the conduit to the fiber hut, and thank you very much for passing that and getting the fiber hut approved. Just to address, in case there's any question on that conduit that we do need that easement for, it is very critical. Without that, there's no light source to the fiber hut. Without the light source, that means no broadband out of the fiber hut. So, just to help with understanding a little bit of why that piece of conduit is necessary and very, very critical part of that fiber backbone. Because the light source travels into the county out of another fiber hut, and it just continues transitioning on. It supplies the broadband services to all of the equipment, and then it's sent out to all of the homes and the businesses from that point. So it is a critical thing, so thank you for considering that as well as as you think about that in the future. Just a quick address, I will address it as being a representative of Firefly. There was a question about the 30-foot easement, temporary easement as it's worded in there. Just from being in the communication side, building towers, building sites for Rappahannock Electric for the past 25 years, it's just a necessity thing. It's not something that's going to be there permanent, but if you think about the way that things are set up, the building is prefab, so it comes in on a tractor trailer. The crane has to have a place to set up. Other construction equipment needs places to maneuver. So by doing that temporary easement, it's doing the right thing to allow those construction services to be able to do what they need to do, not get off on the wrong property or anything of that sort. So since it's temporary, it is something that is very much needed. You've seen cranes set up, by the time they stretch out their outriggers and a tractor trailer may park beside it, you've eaten up 30 feet in a hurry. So it is a good thing. So there again, I'm addressing it from building towers and setting communications huts for REC for the past 25 years, but the same principles apply. So just thank you for your support for the broadband in the county. It's very much needed. We hear that frequently. One of the things that we've heard from REC members for years is, you're my power provider. What are you going to do to help me with broadband? So partnering with folks like Firefly and the counties like yourselves, our goal is to get this out to the members, and we appreciate your support. Thank you.
Thank you.
Yes, sir. We appreciate you all as well. Thank you. All right. Any further public comment? Okay, well, we do need go into closed session tonight. Ms. Hoffman?
I move that the board convene in a closed session pursuant to Virginia Code Sections 2.2-3711A7 for consultation with legal counsel and briefings by staff members or consultants pertaining to actual or probable litigation.
Second.
Very well, we have a motion and a second to go into closed session. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, nay? All right, we are in closed session. Thank you all very much.
Mr. Jackson, we're going to dial you in, Mr. Jackson. We'll end the live stream now.
This conference is no longer being recorded.